to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good afternoon again to our listeners. Welcome to another edition of the program. I'm your host, Rehanna Ramsay, and today we have with us Dr. Reza Niles, the Lymphatic Filaria Coordinator at the Ministry of Health Vector Control Services. She will be talking to us today about the continuing mass drug administration against lymphatic filaria and the intestinal worms campaign. Good afternoon, Dr. Niles. Welcome to the program. And if you want, you can just share a bit about yourself before we get into the questions and what you do.
Thank you, Ms. Ramsay. Good afternoon, everyone. Good afternoon, everyone in the studio, and good afternoon to the listeners. As you said, I am Dr. Niles. I am the coordinator for the filaria program, the elimination campaign, that is. I am also the focal point for neglected infectious diseases in Guyana, namely Chagas, Leishmaniasis, soil-transmitted helminth, and of course lymphatic filariasis. And we are here to discuss really the campaign, how it's important to you, and what we can do to help, and to really answer some pertinent questions that persons might have in their mind that are unanswered. I'm going to try to provide some clarity today for you guys.
Okay. So, for those who don't know, I mean, there has been a campaign on for some time, and people know about what we call Bigfoot and, the common names that we use here in Guyana. But what is filaria in the medical term? What is filaria?
Well, what we call filaria here in Guyana is what is referred to as lymphatic filariasis. Mm-hmm. It is really a vector-borne, or probably better understood, a mosquito-borne disease, meaning that it's spread through the bite of an infected Culex mosquito that bites an individual, and they deposit what we call microfilaria, which are really tiny worms. They go into the bloodstreams, and in the bloodstream they go to the lymphatic system, multiply, they cause inflammation and destruction there, where we get this gross swelling over time in the limbs, which is the hands and the feet, the breast, and even the scrotums.
Mm-hmm. And is there, in terms of symptoms, how early does a person start showing symptoms? Because we would have seen the flyers where they show that persons with vomit. Those are normal symptoms for any illness. So how do you really know that it's a symptom for filaria?
Well, lymphatic filariasis is a chronic disease, and I'm sure the public is aware of chronic diseases like hypertension and diabetes. I just want you guys to know that filaria is a chronic disease. This chronic disease, like every other disease, manifests, or maybe like some disease manifests their signs and symptoms a little later on, maybe 10 to 20 years on. So you can be infected with disease and not have any signs and symptoms. These signs and symptoms that you would see eventually are what we call the lymphedema in the legs, which is swelling to the legs. And we know the gross process in which it can reach to, or the gross stage, is what we call elephantitis. We also know they have this swelling in the breast, which can get very bad over time. We can have the swelling in the scrotum, and we have a very bad name for that on the streets.
Yes.
But it's called hydrocele. That's the right name.
Yes.
And of course, the swelling in the arms. Basically, any part of our body that the lymphatic system goes, those organisms goes and cause problem, and we can have swelling. And the thing about it, it is irreversible. Once it progresses past a certain stage, once you have signs and symptoms, it's irreversible. What we try to do at our clinic is manage the signs and symptoms, help to reduce flare-ups, because the foot can get, or any of the affected limbs can get red and inflamed and even infected. So we really manage the symptoms, but we can't cure it, we can't stop it, we can't reverse it, which is why we're doing the campaign, so that we can prevent you from reaching that stage, not only you but your family, your community, and Guyana as a whole.
So if somebody goes to the doctor and they have certain symptoms like the regular vomiting, dizziness, whatever it is, how do you recommend that they undergo tests that will reveal whether or not they're infected with the filaria?
Well, really and truly, persons who are infected with filaria, in the initial stage, you might have no signs and symptoms. It's actually what we call silent or asymptomatic. Sometimes we refer to things like hypertension as a silent disease or the silent killer, because some people can be walking and might collapse, and then you realize they have pressure. The thing about filaria is that it's also a silent disease in the early stages, or asymptomatic. Or if, as you're saying, we have signs and symptoms, it's almost negligible. You don't notice it, you won't take it that you're sick. But should you recognize that you have the signs and symptoms, which is when you see the swelling to the foot, it's not going down, you don't have any associated pathology that might have caused your swelling, you go to what we call the microscopist, which in the Ministry of Health at the Vector Control Services, we normally do that at night. The ideal timing for taking off what we call the smears, the blood smears, are from 12 midnight to 2 a.m. because that is when that tiny little worm comes out and is in the bloodstream for a mosquito to come and pick it up and carry it and infect someone. So during that period of time is the ideal time for testing.
Wow.
So you can imagine how hard it is to detect filaria in persons. So, and the thing about it, even if you do have a test and it's negative, it doesn't mean that you're not infected. It can simply mean that maybe the worms are hiding and they have not come out in enough concentration for it to be picked up on the smear. So we have to do multiple smears to make sure.
So you spoke about how long the disease takes to develop. Besides there's a space of time, 10 to 20 years before you see the actual manifestation. But is there any other way, like any other part of the body besides the ones that you would have pointed out that is affected by the infection, the disease?
There is another symptom you can get. We call it the milky urine. You can probably have urine that is milky and color and appearance, but that too will take time. And even though I'm saying 10 to 20 years, it really depends on the microfilaria load in the blood, or meaning how many of the tiny worms are there, meaning they're multiplying and they're producing little ones and damaging the lymphatic system. So maybe the manifestations can happen a bit quicker, but it is a disease that progresses. It takes a long time to progress.
So you don't usually see like a child with that kind of manifestation.
You can see children as young. I know of a child as young as 9 years old that had this disease, has this disease. You do see signs and symptoms in those patients.
Swelling?
We are seeing the swelling already in him. And what happens that most times we are living in a highly endemic area, because Guyana is endemic for lymphatic filariasis, and we are noticing that it's a coastal distribution. But the reality is there will be some places that have a higher burden of microfilaria than others. And this young man, perhaps he came from that area, if I can recall correctly, and he already had some signs and symptoms.
So, which areas would that be, like region?
Well, the areas that are endemic for lymphatic filariasis are specifically region 1, but only the Moruca area. The rest of the region we found was not endemic for filaria. Region 2, region 3, the entire region 2, the entire region 3, region 4, region 5, region 6, region 7 will accept only in the Bartica area. The other areas we didn't find enough cases. So region 7 only the Bartica area, and region 10. So the only places we found that were not endemic for lymphatic filariasis, region 8 and 9. That is why we're not doing the mass drug campaign there.
In terms of groups, because there are some illnesses that affect a certain age or ethnicity
Or demographic of people.
or gender. In terms of that, is there a certain that you find would be more susceptible to contracting the disease?
Well, what can I say? Lymphatic filariasis does not discriminate. Anybody can get filaria. Any and everybody is affected, which is why the campaign targets everyone except a certain set of persons that can't take medication. And the reality is these persons might not be able to take other medications. For example, we don't give pregnant women certain medications, and likewise we don't give our filaria medication to pregnant women. We don't give to persons that are seriously ill, because we will give the hypertensive person because they're ill, but they can be well controlled. Similar with diabetics, there are many diabetics, but once you're seriously ill, we don't give our pills to you. And children that are less than 2 years old, we don't give the pills either. But every single person apart from that, they're at risk of contracting lymphatic filariasis and developing the disease. So we target everyone.
Talking about the pills, we started the campaign started about a month ago or so, and you have already covered the coast, most of region 4, and you started region 3. Tell us a bit more about the distribution and why it's important. Just impress upon the listeners why it's important to take the pills and why they have to take so many, because I noticed that it looks as if the pills have increased.
Well, Ms. Ramsay, the filaria elimination campaign was launched on the 12th of February at Rehanna, and we had among us the Honorable Minister, Dr. Frank Anthony, and he made the feature address, and he was encouraging, along with the other participants such as the Chief Medical Officer, the Regional Health Officer of Region 4, as well as the Regional Chairman for Region 4. They were all there exerting the public to take their pills. So we've only started about 8 days. Today is the 8th day.
Okay.
And we started in region 3 and 4. So currently region 3 and 4 you will see persons in purple, the pill distributors walking around distributing pills currently. And we are projected to close off by the 28th of February. However, most times what we do in region 4, we try to still have the medications at the health facilities, the health centers, that is, specifically, so persons can go and receive the drug if they might have missed it during the period we're implementing. And normally we implement 2 weeks in every region, so 2 weeks in 3 and 4, and 2 weeks will be in region 6 and 10 soon. Mm-hmm. And I guess we'll get to that a little later down into the interview, but those are the regions that we're implementing in. So your other question was
I was asking how the pills, how they distributed, and I noticed that there are a lot of pills now. I noticed that and also that you measure people. Why is that important? Tell our those who are.
Well, that's a great question. In 2019 we would have scaled up and updated the regimen of drugs for the mass drug administration campaign to a triple therapy, meaning 3 types of drugs: ivermectin, diethylcarbamazine, which we call DEC, and albendazole. And we did this because it had many benefits. One, it was permanent sterilization of the adult worms, meaning that they can't reproduce. There was clearance in the blood for more than 1 year for the microfilaria. It allowed us to have, instead of doing this campaign for 5 years, we were able to reduce it to just doing it for 2 years. And so the government of Guyana accepted and we updated the regime. The dosing, however, changed from age-based to height-based because of the addition of the ivermectin. So due to that, we have to measure everyone. And normally we do it based on a range. Every pill distributor will have what we call a job aid. They're trained, but they also have a reminder. So there's a job aid that has a dosing schedule on it. And in this dosing schedule, there are ranges. It will be less than 90, 90 to 119, 120 to 139, 140 to 159, and more than 160. So when we measure you on this dose, but we're not looking for direct height. We're not looking to say, oh, you 165 or you 143. All we need to know is if you are, for example, if you're above 160, because once you're above 160, irrespective of your height, you will get 4 tiny ivermectin, 1 albendazole, and 4 diethylcarbamazine tablets. If you're between the height range, for example, of 120 centimeters to 139, irrespective of if you're 123 or 136, you all in that group will get only 2 tiny ivermectin tablets. And for those persons that took the medication already, they know how tiny ivermectin is. 1 albendazole and 2 diethylcarbamazine tablets. The reason we do this is because everyone, we're ensuring this range allows us to ensure that everyone has the minimum effective dose to prevent the development of the filaria, or to prevent the infection from progressing of you to manifesting signs and symptoms. So that is why you have to take the amount of tablets you take. And I know some persons say, why so much tablets? But I can tell you, on average, a person that has filaria have to take more than what we're taking here. And these tablets are all, or the dosing I should say, is a prophylactic dosing. This is the dosing that they found due to testing, clinical trials at the WHO and all the relevant partners, that this is the effective dose that will help to prevent the development of the disease. So it might look like it's a little bit, but when you look at the ivermectin, they're tiny. The albendazole is a regular tablet that we have here all the time for deworming. All of us here probably took it already, most likely. Well, I hope you're deworming. And the diethylcarbamazine is used regularly for filaria patients. So the drugs are not unknown to us. And I want us to start looking at it from a positive light. This is the dose I am required to use to help me prevent me from getting filaria.
In terms of the taking the pills, should persons be tested? Persons would want to know why not test us first before you administer the drug.
Well, as I said earlier in the interview, the interesting thing about filaria, I actually find filaria, the microfilaria, the entire organism, very interesting. The way in which they have adapted. You can take a filaria test and be tested negative and still be infected with filaria. And that's why I said sometimes we do multiple testing, especially when we have a high suspicion of the disease. So a negative test doesn't mean you don't have filaria, which is why you don't require to have a filaria test saying positive for us to treat you, which is why we're targeting everybody. Right? So guys out there, just listen to this. Even if you have a negative test, it doesn't mean you don't have filaria. You should still take the pills to prevent filaria from developing, not only yourself but in your family members, because as I said earlier, the mosquito has to bite somebody that's infected to carry it to a person, right? And maybe it might be carrying it to a not infected person, or worse off, to somebody who is not infected, and those will propel and continue this vicious cycle of infection and reinfection and infection and it will continue. So we need to break the transmission cycle, and that is what the Mass Drug Administration does. It breaks the lymphatic filariasis transmission cycle from continuing.
What, like with every drug, there are side effects.
Correct.
So could you speak to the side effects of taking the pills?
The reality is that these side effects that persons might experience is this triple drug therapy of ivermectin, dec, and albendazole does not cause side effects more than the double therapy we had at one time, which was just the dec and the albendazole that we received once upon a time. So that's the first statement I want to make. But the adverse events are very common, as in there are common things that drowsiness, nausea, abdominal pain. Some persons might have fever. Some persons might even have rashes, which probably might be an allergic reaction to possibly one of the drugs. Once you have any of those, it's not supposed to last, and normally it doesn't last longer than 24 hours. However, in the interim, while you're experiencing that, I would advise, if you are concerned and you would like to have some medical attention, feel free to go to the health center. Because, for example, if you have a fever, we would probably give, based on the doctor's assessment, they might give you a Panadol to carry down the fever, or even a Panadol for a headache if you're having a headache. These symptoms are treatable. It's nothing outside of the realm of what we do here in Guyana in terms of medicine and symptomatic care. So it's nothing to be alarmed about. And the triple drug therapy safety profile was approved by the World Health Organization. And if it was not so, we would not be using it here in Guyana. So I can tell you these drugs are safe, and not only safe, but effective. So they will do what they said they will do.
Good. Thank you, Dr. Niles. We take a short break now, and when we come back, we'll hear more from Dr. Niles on the elimination campaign, or the Mass Drug Administration campaign for lymphatic filariasis and intestinal worms campaign.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Welcome back to the program. I'm your host, Rehanna Ramsay again, and we're talking about eliminating filaria. We have with us Dr. Niles from the Ministry of Health Vector Control Services Unit, and she'll be telling us more about the Mass Drug Administration campaign that is ongoing. The last question I asked you, Dr. Niles, is about side effects taking the pills. But earlier you would have mentioned that there are some categories of people who are necessarily not don't fall in the category of being eligible for the drug. Could you refresh our memory as to some of those persons? Because I would have, as you would have mentioned, they have children below the age of 2, those who are breastfeeding. So could you give us some more in that area?
Sure. Thank you, Ms. Ramsay, for that question. And it's one that I have no problem reiterating, because I want the general public to know that we do have our guidelines, and our guidelines are we would not be giving the pills to children that are less than 2 years old. So once your child is 2 years and above, they can receive the pills without fear based on height after we measure the child. As well, we don't give the pills to persons that are seriously ill. We don't give the pills to persons that are pregnant. So those are the 3 main categories we don't give. For breastfeeding mothers, we give the medication to them. The only difference is that if the child is 1 week old, we would not, if the child is 1 week old and less, we only give the dec and the albendazole. We don't give the ivermectin. So we measure the mom and we give her the appropriate dec and albendazole that is corresponding with her height. And if the child is older, we give the normal ivermectin, dec, and albendazole based on height as well. So those are just the 3 persons we don't give at all, or the 3 categories of persons. And just a slight modification for the breastfeeding mothers. But everyone else is eligible to take their pills and should take their pills.
In terms of other types of medication, if, for instance, a child or even an adult takes deworming, they're on a deworming, took the deworming pills, is it safe for them to use the filaria
Yes,
drug?
it is. It is more than safe to use if the child already had it would not cause any problems, and also it's quite safe to take because we take into account and noting that these are prophylactic doses, so we have no problem with that.
So
they
there's
can participate in the campaign.
So there aren't any category of drugs that would kind of conflict with the filaria drugs.
There are a few individually, but those are for persons that are seriously ill, and those are the persons that we don't normally give the drugs to. So there's no problem. And those persons would normally be admitted to a hospital, or maybe they're stable and they're on a certain med, and the doctor would advise them not to take the pills. Apart from those, everyone else can take.
What about those persons who use alcohol and drugs, marijuana, they smoke? What?
Well, those persons, it's fine to take. Well, first of all, I want to say, representing the Ministry of Health, we don't advise anyone to take illicit drugs and alcohol in excess. But I just want to say that these drugs don't compete with these for processing in the body. Meaning, I'm trying to simplify it in my mind. It doesn't compete with the metabolism of these drugs in the body, meaning the breakdown of these illicit drugs.
And it does not conflict because it
there's
doesn't.
no conflict.
Wouldn't
Correct.
cause complications.
It won't cause any complication. You can take it normally, and you have no issues.
So we have persons going about. They're wearing, as you have on your purple T-shirt, and they would have the filaria elimination campaign logo on one end and the Ministry of Health logo on the other end. Is that the regular way of identifying? Because we just want to make sure that the public knows how to identify
These persons.
these persons. How do we identify them?
Well, those persons you would see in the fields, we call them pill distributors, and they would be attired in a purple T-shirt, as you rightly stated, with the filaria campaign on one end, normally the left hand, and on the right hand would have the Ministry of Health logo, followed with our collaborating partner, Pan American Health Office, World Health Organization, as well as they would be attired with a badge that states that they're a pill distributor, and they would have at the back from in the front they would have Ministry of Health in collaboration with PAHO, so that they can be properly identified. The other thing, they will have their dose pole because they have to measure your height. They will also have, some of them might have the caps on, depends on if they're son or not. But those are the main things you look for: the badge, identifying them as pill distributors, and the T-shirt.
And these persons are volunteers, or are they working with the ministry?
They're actually a whole host. We have a mixed variety of staff. The majority, the reality, is our medical professionals, mainly nurses, and a few doctors here and there. And some are, which is the minority, are community volunteers.
So, in terms of, because we have COVID-19 going on, we're in the middle of still battling with COVID-19. That's a challenge.
That is true.
How has the COVID-19 pandemic affected the way you do your mass distribution? And I'm not sure, but I think it's annually. So how has it affected you from last year to now?
Well, I think we can all appreciate the impact COVID-19 has had on the world and on Guyana. Things have, our normal has changed, and we have a new normal. We have adapted, and likewise the program has adapted. As you rightly stated, our program is an annual program. We give it once a year. And this triple drug therapy, we only have to give it for 2 years. So we gave it in 2019, and now we're giving it in 2021. So there's a slight little
Break.
2020 we had nothing, because we all know we had to make sure we were doing the right thing to not propagate the spread of COVID-19 and follow the right protocols. But having noted that those were developed and guidelines were shared we as a program, we would have trained from the pill, I should say straight from the national level, myself straight to the pill distributors. We were all trained in the COVID-19 protocols, such as wearing the mask, which everyone has to do, sanitizing your hands at the appropriate intervals, as well as we, well, let me go specifically for the MDA. What we do normally, since 2019, we normally use gloves. The pill distributors put on their gloves to give the medication, because that's just a good hygiene, just a good hygiene method, and one we wanted to maintain during the mass drug administration. And we normally provided sanitizers to sanitize your hands should it become untidy. So those were things we were doing since 2019, but with the impact of COVID-19, we have reiterated it. And now what has been added is the wearing of the mask and the social distancing, which is a part of the guideline. So what we do, we refrain from gathering too closely to persons. We advise persons to have their mask on until you come to that time when you're going to ingest the pills. But in every interim when you're talking, you have your mask on. And we sanitize your hands before you take the pills, because we put the pills in your hand and we just want to make sure that your hands are okay, and then you can ingest the pills. If you're in your house, we advise you wash your hands with your soap and water, because as we all know, soap and water is also effective, if not more so. So that's what we have done. So the COVID-19, though it has made an impact for us, it was an impact that we appreciate, and it reiterated what we're already doing, which is hygiene methods, making sure we're safe, and we're also trying to make sure we're not a part of the problem like all guidelines are trying to do.
For those who would ask this question, because I would have drawn my questions based on frequently asked or concerns about from people who were supposed to be at the other end of receiving the drugs. But why is it important for these persons to the distributors and the persons receiving, for them to be there when they're taking? Why do they have to take it in front of them?
Well, that's an excellent question. Well, we have trained the pill distributors, and every single person hired in MDA is aware that we do something called, where we utilize a method that is called directly observed therapy. Meaning that when we administer the drug to you, we need to verify that you've swallowed it, or verify that it is utilized, and then we make a note it, and then we say, well, X person or 3 persons or 4 persons have taken the pills. The reality is that this is not a guideline that we have come up just like that. This is a WHO recommended guideline, and to be honest, this is not the first time it has been used. Persons taking tuberculosis drugs or TB drugs, as we say, this is a practice that was done, or perhaps is currently being done in that area of health as well. So this is not something that is new to medicine, but it's something that I guess the public is aware of, because it's such a mass scale, it's such a large amount of the population that we target. So persons might be concerned, but we're not trying to force you, we're just trying to follow the guidelines that were recommended to us, recognizing the importance of doing it, because what it does, it assures that the MDA is of a high quality, because we can say, well, we have treated 70 persons. So that is why when persons are asking to take away the pills, we say no, not because we don't want you to have it, but we must have evidence with our own eyes using DOT, which is the short abbreviated term for directly observed therapy, that you have taken the pills, so that we can ensure we have a quality MDA. We can monitor that indeed our pills are being consumed, so that later on when the WHO comes to verify that we have taken these pills by doing testing, and they test, we should have no failure, no case, no person being infected. That is the ultimate goal.
To eliminate.
Correct. To eliminate the transmission of lymphatic filariasis.
In terms of options for prevention, treatment, are there any options in terms of, besides taking the pill? Do you have any other way of?
Well, we hope you never reach to having to be treated, because we already know that the stigma, the discrimination, the comorbidities, the burden, your mental health is deeply affected. You can ask any filaria patient and they will tell you that this is no easy disease. No disease is easy, and filaria brings its own burdens because these limbs are grossly swollen. So once your limbs are grossly swollen, we have to take care of the limb with you, help to advise you on the appropriate cleaning, the appropriate exercise, the appropriate care that is required on a daily, and this is not easy. So if you are, based on your question, if you have the disease, we go through that step. We have to begin to treat you. You have to take medications ever so often, and you are a permanent member of our clinic, right? So that is for the rest of your life. You have treatment. So the best case scenario is taking the pills once in a year, and not only you, but encouraging your family, because our aim of this mass drug administration is to attain above 65% coverage, meaning if we have 100 persons, 65 of them, we need to make sure that they is taken, or even more, because our aim is not just 65. 65 is a baseline. We want to have a higher coverage than that. But first, we must pass that 65 line to reach 80 and 90. So the more persons take, the more we can guarantee that the transmission of filaria will be stopped, which is the aim of the campaign.
And just to clarify, the pill is the only way of preventing.
Correct. Apart from, of course, vector control, which we also is in collaboration with, and the vector control is like using a net, making sure you don't have stagnant water, but that is not sufficient alone. So no strategy is sufficient alone. Everything must come in combination, and the mass drug administration is sufficient for sure to help you to prevent it.
The mass drug administration. Tell us a bit about how you're doing that, because I know you have the regions. You started with region 4 and region 3, but what about going into the workplaces? How specifically, can you give us like the specifics of the administration, how you're doing it?
Yeah, certainly. What I would like the public to know, those that are listening, is that what we try to do with the mass drug administration, as we've done for every single time we've done it, we go through 3 strategies. We reach you at 3 different specific strategies. One being in the schools. We normally go to the schools, but of course we're all aware that it's partially closed. So those that are in the schools, we will go to them, but the rest we will reach at the household, which is another strategy. So that's where we'll get a majority of persons treated, and we will also reach them at the last strategy, which is called fixed point, and that's simply a fancy word for any point where we can reach the mobile population. For example, at Stabrook Market, at Border Market, maybe at the Stelling, maybe at some post. So really and truly, we would reach you any single where, but mostly in the home due to the COVID-19 guidelines of not gathering. We know we'll reach the persons, the majority of them at home. But you will see those persons, and you can even go to the health center. Any of health centers in your community, you can go there and get the pills. Right? You can go on the field offices right there, and you can also get your pills right there. So apart from the PDs walking around, going to the homes and the school, you can go to your nearest health facility, and there's a health center that is, and get your pills.
Okay. So we'll just take a quick break, and when we come back, we'll continue talking with Dr. Niles about eliminating filaria in Guyana.
Guyana, please join me on the Glenn Lal Show, 99.1, 99.5, Kaieteur, every Monday, Wednesday and Friday, 7:20 p.m. and a rebroadcast of the next day at 11 a.m. just in case you missed that program.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Hello again, listeners. Welcome back to the program, Your Health Matters, and we're talking with Dr. Niles from the Ministry of Health Vector Control Services. She's telling us a bit about the mass drug administration for lymphatic filariasis and intestinal worms campaign. and she will impress upon us before we leave a bit more about the importance of taking the pills. Dr. Niles, could you tell us, just emphasize, why is it important for us to take these pills, and what happens if we do not take the pill?
That is a very good question, because sometimes I think sometimes we forget, or maybe some persons are not aware of the aim of taking these pills and why it's so important. The reality is, if you don't take the pills, you are now at risk. And I won't even say no, you've always been at risk once you're living in the endemic areas of getting filaria, but now you've lost a chance of getting your filaria pills. And mind you, you still have an opportunity, so no chance has been lost as yet. But when the campaign finishes, if you have not taken your pills, you would have lost an opportunity. So I encourage you guys to take your pills. So you will be at risk of becoming infected or becoming ill due to the filaria infection. You would also participate in transmitting these worms to your family members, because the mosquito will bite you and will surely bite your family members, your loved ones, people in your community, and without you knowing, and therefore they will eventually over time become to develop these chronic signs, this lymphangitis, the hydrocele, the swelling to the arms, and all the mental health issues that are attached to this, the stigma, the economic cost that it causes on the family, the burden that person sometimes feels like if they are to their family, especially when we're not aware of the disease. So if you don't take these pills, you're saying yes to all these other things I just mentioned.
Yes.
So you should say yes to the pills, yes to preventing filaria, and the reality is saying yes to getting better health, having a better health outcome, because we don't want to live today for today. You need to plan for your future. As we all know, COVID-19 has taught us good planning. It has taught us the importance and appreciation of your health status. So take these pills, because filaria is a chronic disease, and we can see how chronic diseases contributed to the
For the person
of
who
other
says,
diseases.
for the person who says, oh, I took the last time they had the drug distribution, why should I take now? What would you?
Well,
how
I would
you-
say
you
to
advise
those
that person?
persons, the campaign is based on annual drug treatment or annual administration. So that year when you took it, great, right? And you participated in being a part of the 65% of persons that took it, and we achieved our target. This year you need to take it again, because it's an annual. So that year was a standalone, and 2021 will be a standalone. You take your pills, you have your coverage, and you contribute to the 65% and above person that would take the pill. And we achieve our goal as a country, because we're trying to eliminate filaria in Guyana. So you have to take your pills every single year that we're admitting, even if you took it before. That is how it works. Your drug coverage lasts for a year. So 2019, when you took the pills, we congratulate you. If you didn't take it in 2019, but this is the first time you're taking it 2020, great. You have taken the right decision, and you're saying yes to helping to prevent filaria, and you will become a part of that number of 65 and above persons percentage that we want to achieve to get our target of eliminating the transmission of filaria.
And the drug administration program is being done in collaboration with PAHO, WHO. Tell us a bit more about that partnership. I know that they would have contributed some amount of funds and so on.
Correct. The Pan American Health Organization, through the country office we have here in Guyana, is where the donors are able to reach us, and they donate. The medications, first of all, are donated. We also receive the supplies, such as even the jerseys, the dose pole, through that collaboration. And they assist us in, getting the necessary literature, getting the up-to-date guidelines. They are very helpful, and they're a key part in this implementation, and we could not have done it without them, and the Ministry of Health is very grateful to them. And I just wanted the public to know that we're implementing, yes, in Region 3 and 4, but from Friday we'll be launching in Region 6 at the Regional Democratic Council tarmac for 9 o'clock. They can go there to receive their pills, and from Monday They will be distributing the pills in the entire of Region 6, as well as on Friday as well. Sorry, Region 6 is on Saturday, but Region 10 will be on Friday. They will be launching as well at around 8:30 on Friday, and they will be distributing for the entire 2 weeks in Region 10 starting from Monday. So guys that are in Region 6 and 10, you can look out for the pill distributors to be your way. And the remaining regions, Regions 1, 2, Regions 5 and 7, they will be implementing the following Monday, and they will have, which is about the 5th and the 6th of March. And you could look forward for your 2 weeks of implementation, so you can prepare yourself to receive your pills as well.
So just before we go, just tell our listeners and those who are viewing on Facebook, where can they go to get more information in case they're curious about something that we did not cover? Where can they go? And in terms of those persons who already have the disease and they're suffering, where can they go to get
For persons that want more information, you can speak with the pill distributors and those persons you see attired right in the fields, or you can go to the health center, the health facility nearest you, and you can get information, and it's always transmitted, and we can answer your questions. They can answer there at that level, and we also support in answering the questions. Those that are suffering or may have already had the manifestations, what we encourage you is to go to your nearest health facilities where the doctor assess you normally, and during the ruling out process, or what we call differential diagnosis, once failure is one of the suggested disease, they test for it, or there's a clinical suspicion, we start management, and we speak to the patient individually to indicate to you how it will be, what drugs you will have to get, how often you come to clinic, and things like that. So you can go to your nearest health facility, and the doctors would reach out to us at Vector Control Services, and we provide guidance.
Well, that brings us to the end of our program today. For all those who tune in, we want to thank you for listening, and we want to say, do enjoy the rest of your day and be safe. Bye-bye.
Thank you for having me.